My name is Dr. Mark Rosenberg, and today I'm going to talk a little bit about asthma. Uh, no way does, if you're having an acute asthma attack, no way is this video for you to watch and get relief from in a potentially life-threatening situation. But I want to give you an overview from Oriental medicine and holistic health that may give you a greater picture about asthma and some points to press and some ideas for you to think about. Well, let's go back. The lungs in Chinese medicine are called the delicate organ. What does that mean? They're most often affected by colds, drafts, bacteria, viruses. People get exposed to pneumonia. They get exposed to colds. And they have a respiratory distress. That's not unusual. People call me up and say, Mark, I have a chest cold. What should I do? What does that mean? Well, the lungs are affected. They're the delicate organs. Inside your lungs are little tiny bronchioles that exchange oxygen. Okay, that's one of the functions of how we breathe. If there's tension in the area from emotional stress, okay, chronic long-term emotional stress can bring on asthma. Sometimes it's traced to a traumatic event that might have happened in somebody's life or that they might have witnessed. It could also be a function of some chemicals in the body that shouldn't be there. Some people have asthma as a response to food or certain drugs. And last but not least, people can have exercise-induced asthma with the constant conscientious constriction of their lungs, let's say when they're running or doing something of a physical nature, brings on this asthma and this constriction. If there's an emotional root, you're going to have to dig and look to figure out what it is so you know what the trigger is. Then you have to evaluate that and do some work on yourself. You might want to work with a professional, health professional, to figure out what that root is and how to eradicate that from you. If you're constantly having this reaction, it's not good over time. Lost my screen there. In the case of the lungs being the delicate organ and easily damaged, there are points that you could press on to help bring more blood and therefore chi to the area, which will help you. And I'm going to show you some of these. First of all, should you find yourself choking, not food type choking, but you can't breathe from here, this here is called the interclavicular notch. It's at the top of your sternum, which is your breastbone. You take your middle finger, because it's the longest, and hook it this way and pull down, not into your throat, you'll choke yourself, but down. It's going to be tender and it's going to hurt, and it will help to disperse the tension, that choking feeling that your throat's closing up. Okay? And in Chinese medicine, that's called plum pit chi. And what this is a point to stimulate opening that area up. Along the same lines, if you take your thumb and you go down, this here is your deltoid muscle, and right on top of the acromion process is another lung point that you could press. Okay, it's right in here, and it will be tender. And of course, you do one side, you do the other. And again, if you're in an acute state where you're then you can't breathe, it may not be the time to do that. You want to do this ahead of time to prevent an attack. Although in an attack, if you know where to press, it can be of value. Okay, so you get in there and they dig. And then lastly, for these points, your second rib on the top here, if you dig in there, my hands are big enough, I could take my thumb and forefinger like this, like a hook, kind of like in Kung Fu. Anyway, and you reach in and stimulate and press these points. They will be tender. Now let's look at the postural effects. If somebody's having an asthma attack, they're not standing up tall and straight. They're curved over. They're coughing. They can't breathe. So energically, all those points I just showed you do the opposite. So energically, the body wants to close and constrict. Energically, these points, plum pit chi, shoulder, okay, top of the lungs, second intercostal space, which is the first intercostal space is under the first rib. This is under the second one. You get in there and you dig. You could actually do it like this as well. That opens up this area. So energically, you're doing something opposite to what occurs during an asthma attack. Now, again, when you work on this, you want to work on this ahead of time. So if you are an asthma sufferer, I'm not telling you to give up your inhaler. I'm telling you to find ways that you could naturally enhance yourself. You want to roll your other exercises you could do that could help. You want to roll your shoulders back and open that up. Okay, you want to bring your shoulders up to your ears, and I talk about this in the shoulder stretch exercise videos earlier on. Go search, there's about 65 videos on my channel here. Bring your shoulders up and drop them. Bring your shoulders up and drop them. That's your nerves telling those muscles to contract, and it's your nerves telling those muscles to relax. So you're trying to open up this area. In yoga, there's a posture called cobra, okay, where you stretch backwards. That's going to help. Anything to open up this area. And all those things are, like I said, possibly short-term or maintenance issues, but not to be used in an acute attack for the first time instead of an inhaler. Okay, of course, if you do need an inhaler, you know, the asthma is deeper in there. And keep in mind, the longer you practice something, the better you get at it. So if I were a sufferer of asthma, I'd be practicing these points daily. When I was a kid, I hurt my knee in karate, and I went to my teacher thinking he would do acupuncture on me. I'd be ready to work out the next day. And he looked at me and he said, no, I'm not going to do that. But what I will do is I will show you the points to fix it yourself. And what I did is I started pressing on these points. These were on my leg. And my knee didn't get better the next day. It didn't get better the day after that. It didn't get better the week after that. It took 2 months. And I was off of martial arts, the thing I love to do. I had to do limited motion for a lot of movements till I fixed my knee. After 2 months of pressing the points, I was back to being able to thrust out kicks in karate and do what I wish to do and go running and everything else I like to do. I was upset because I wanted it to be fixed right away, but long term, that little episode of pain that I experienced turned into a wealth of knowledge I got from my teacher in the area of knees and lower extremities that were able to help me and many, many, many of my patients over the years. So here's a few pointers for asthma. Now, also in Chinese medicine, all the organs are paired up. Okay, the lung is connected to the colon, and medical doctors have known for a long time that if somebody has a cold and then they have a good bowel movement, most of the symptoms of the cold go away. And the reason is that when you're expectorating, when you're swallowing saliva, when you have an upset stomach, all those toxins have to go somewhere. So they go down into your colon. You have a good bowel movement, guess what? You know, you're going to feel better. That's why the previous 2 videos about cleaning your colon can also be of great help to asthma sufferers. Because the fewer toxins in your body, the less of a likelihood for there to be dis-ease or a lack of ease between the lung and the colon. Okay, so that's today's video on howtostretch.com. Come back, tell your friends, and this is an important one. If you know somebody suffering from asthma, have them watch this, have them digest it. And if you don't have asthma, you could practice these points yourself. Someday you may get a cold, you may be on an airplane and people are coughing next to you, and these are a way to help you strengthen and tone your lungs. Alrighty? Come back soon. Bye.